Good morning, members. We have reached the. We have a quorum, and we've let us invite the officials into the room. Please also invite the teams, or rather the 20-odd groups into the room. They are here for the first session. May I welcome the government officials, and they are Ms. Tam, Permanent Secretary, Dr. Choi of the research team, Mr. Lam, Deputy Director of Social Welfare, Mr. Donald Chan, Deputy Secretary for Labour and Welfare, Mr. Steve Chair, Principal Assistant Secretary, and Ms. Lee, Assistant Director of Social Welfare. Now, please invite the deputations into the room also. This is a special meeting of the Welfare Services Panel. We are here to listen to the views of the various groups on the Elderly Services Program Plan. And I also want to thank Dr. Choi, Principal Investigator of the consultant team, for coming to assist us with the discussion. I know that members are very concerned about this issue. This is a very fresh issue because the study has started just not too long ago. After hearing the views of different groups, I hope the government team can consider or take on board those views. I don't know whether we can deal with some issues because some say that the brief of the for the consultant team is too narrow in terms of scope. And some members are of the view that putting elderly services program under welfare is narrowed down the scope, and that may not be appropriate. And I also welcome views on that. May I welcome the groups for the first session. Now, you are here to give your views on the Elderly Services Program Plan. I want to remind you that if you want to listen to the floor channel, or rather, if you want to listen to Cantonese, Channel 1, Channel 2, English, Channel 3, Putonghua. And then I will ask you to speak according to the order of registration. And you will be given 3 minutes for giving your views. I want to remind you that your speech or your submission is protected by the Legislative Council Powers and Privileges Ordinance Cap 382 of Hong Kong law. That just means that you are responsible for what you say. If you have any written submission, we welcome that. And if you have any written submission, you can give us even after the meeting. Before we start, to ask the deputations to give their views, if I may ask the officials to say something. As for those who are sitting in the public gallery, I'd like to remind you to pay attention to the guidelines for those attending LegCo meeting and those hearing the meeting in the public gallery. Just some formality, because I don't expect that there will be anything untoward that will happen. Thank you, Chairman, for arranging this meeting within short notice so that we can listen to the views of the deputations. We are facing population aging, and there are challenges arising from that in respect of welfare services, elderly welfare services. The Elderly Commission was asked to draw up a program plan under the Policy Address 2014. There are three stages for the work. The first is to set out the scope. The objective is to collect the views of the stakeholders on elderly services so that the group can set out the scope of the elderly services program plan. Having set the scope, the working group will move on, or rather the Elderly Commission will move on to making recommendations. That will include consultation with stakeholders on preliminary recommendations or proposals. The third stage is building consensus. Stakeholders are asked to discuss preliminary recommendations with a view to reaching a consensus. It is hoped that that can be completed in July 2017. Therefore, a report can be made to the administration according to the plan of the CE. That is, to give a report within 2 years. We also said that at every stage there will be public engagement exercises. We would like to listen to different views. In November, or rather October to November last year, there was a public engagement exercise on the scoping stage. There are 5 focus group meetings, and we have also received many written submissions. Chairman, we hope that having heard members' views, in December we would like to listen to views of the groups further. We noticed that some of the groups present today did attend our public engagement exercise in November last year. I would like to thank the groups for giving us their advice and giving us their support, and I'm happy to listen to their views. Thank you. Madam Secretary. Dr. Choi, do you have anything to add? Probably let us listen to the views and then you will respond. Let us now invite the groups to give their views, about 3 minutes for each group. The first, Mr. WONG, Cheuk-kin of Yuen District Council. Chairman. Now, we hear this.
Country. 但係喺香港真正好值得我哋反思嘅問題係。
Now, what is worth considering is that do we want to hear an elderly who works until 70 or 80 still ask what can I still do for you? Many are asking for the answer to the issue of long queue waiting for the RCHE and asking for more places for our CHEs. But the proposal is not entirely correct. According to number 63 report of the Commission of Audit, the number who joined the voluntary scheme declined from 7% to 5% from 2009 to 2014. And every year, about 600 residential care places costing about $50 million are paid, but these places are not taken up. Why there are still large number of vacancies? The enhanced voluntary board place scheme only accounts for 5% of those on the waiting list. Many elderly prefer to wait for a place in subsidized homes rather than get a place in the enhanced board place scheme homes. The occupation rate is about 85%. This is unprecedentedly high. Quality institutions are short in supply.
Therefore, the right to quality homes is reduced. All along, we say that Hong Kong wants to take care of the elderly, but every year we see an increase of 2.5%. Last year, we got a reduction of 1,600 beds. The government will say that this is a market issue, but if we don't have effective policies to address market issues, we'll see a more serious problem. I'd like to have 3 proposals. Every year, there should be an increase in the ratio between bought places and subvented places. Then taxpayers won't have to waste money on vacant beds. Number 2, in remote areas, large homes should be built to take care of 1,000 to 2,000 elderly per home. With low rent and with a contract, there should be further collaboration with the private sector. Then we can effectively monitor the quality of homes and to have 0 vacant beds. Number 3, I'd like to once again remind the consultancy that blindly increase the number of bought places will actually lead to a reduction in bought places, because for Class A beds, the average area is 10 square meters. For ordinary homes, 7 square meters only. Sorry, time's up. Next, Mr. Stanley, Executive Director of Hong Kong Rehabilitation Power. Thank you. We're celebrating our 20th anniversary this year. 20 years ago, the average age of our members was about 40 years old, or actually 38. After 20 years, our average member age is over 50 years old. As for persons with disabilities, the PWDs, when they are young, it's difficult for them to take care of themselves. Very often they need their parents and family members to take care of them. Now they're aging. It's difficult for them to take care of themselves. Furthermore, their parents can no longer take care of them. Filial piety is important for Chinese people. These PWDs want to take care of their parents, but in vain. Now this is a common phenomenon among our members. In society, we have the young elderly, middle-aged elderly, and elderly. There's one more category, the disabled elderly or weak elderly. These elderly and their parents cannot leave their beds. So they're actually looking at one another with no ability to act. Improvement measures have been proposed, but there has not been any long-term planning. Our association would like the government to look at the PWDs' homes to take care of them, whether or not they can take care or live together with other elderly persons with the family. We must have long-term planning. These are our opinion. Thank you, Mr. Ng. Next, 長者社區照顧服務關注組, a concerned group on community care for the elderly. Mr. Ng Ming-Wai. Our concerned group is formed by a number of frontliners. For the elderly services program, we have the following opinion. Number 1, you should review whether or not the existing policies and measures can address the physical and mental needs of the elderly. In 2010, we got the residential care services for the elderly. 2011, a consultancy study on such services. That is to have in-depth discussion on the physical and mental needs of the elderly to see whether measures and policies can meet their needs. If the consultancy team can take into consideration the existing services and compare them with the needs of the elderly, physically and mentally, then there are gaps. First of all, the elderly cannot get suitable services. Secondly, services have not been effective enough. Members of the consultancy team as well as the officials, please look at our position paper. There we present you with a full picture. And then for integrated household care, basically they're covered by long-term residential care and services for elderly with a slight degree of disability. For long-term care services, these elderly with minor disabilities will deteriorate in health, so more resources should be given by the government to do preventive work. Unfortunately, government officials have always been saying that resources should be used on the most needy. For ordinary cases and integrated home care, we get increased expenditure every time, but only 6.8% of increase in the past 10 years, but inflation has gone up by 21%. Our officials should know this. For elderly who do not want to undergo the integrated tests, the Hong Kong U is commissioned to do an integrated study. We suggest that under that study, there should be a part for the elderly with minor disabilities so as to appropriately take into consideration their needs. We would like the government to address this issue in a moment. And then for subvention modes, in 2014, the government announced that there will be a retendering for the service. We can see that after 2 years, the government has to retender the service. That's a serious problem. So we should regularize these home care for the elderly. Next, Ms. Nam Ling from the Forthright Caucus. Thank you. For stage 1 public engagement on scoping, scoping shouldn't just be confined to social welfare. The government spent 2 years to prepare the overall elderly services program plan. A comprehensive review should be conducted on all policies and services related to the elderly, including housing, medical services, employment, and so forth. Individual issues like carer problems, barrier-free access, as well as the laws should also be reviewed. Now, the program covers a lot of areas. It's difficult to handle all of them in the short term, but the government should give us a timetable. Secondly, for data-based long-term planning, in 2040, Hong Kong's overall population will be $8.4 million. Around 2.6 million of them will be above the age of 65. So elderly services will grow tremendously in future. But the government has not given us any specific projection data. According to reports of the Census and Statistics Department in 2005 and 2009, with detailed survey on the elderly covering housing, financial position, physical and cognition, ability to care for themselves, need for long-term care, and so forth. If you use these data appropriately, you can project the demand of the elderly for services. And the government can forecast the services and manpower required and other resources required. Elderly services must be put under a mechanism to have regular survey on social conditions of the elderly and service conditions so as to have long-term planning. Number 3, as we propose, the government must promote a mode of neighborhood help. The government would like the elderly to age in place, but both in terms of quality and quantity, we do not have sufficient services. Only the weak elderly can obtain services. For the healthy elderly and those with minor disabilities, what will happen to them? In Kwai Ching, a concerned group offered a canteen services offering meals at $15 per meal with 4 dishes and 1 soup. This is to allow the weak elderly and those with minor disabilities to be sustained in the community and to foster the spirit of neighborhood and to make use of community resources to serve the elderly. However, that concerned group does not receive any subvention from the government. They have to finance themselves, so they encounter huge financial difficulties. Next, Mr. Lo Ho Yuen from the Labour Party. Thank you, Chairman. We're discussing the Elderly Services Program Plan, but here we have many PWD groups. The concept of long-term care must be adopted in terms of planning for escort services, for medical consultation, physiotherapy, etc. The needs of the elderly are very near to those for the PWDs, so you have to look at the individual's needs in offering services. Number 62 of the audit report says that we now have 570,000 PWDs. 33% are above the age of 70. So there's a close correlation between the elderly and the PWDs. And for the disabled elderly, we got 42.6%. So elderly services and rehabilitation services shouldn't be separated. That's not in accordance with international trends. Of course, we now have a framework for elderly services, so the Labour Party would like to offer the following suggestions. We have to face the aging problem of the elderly as well as the carers. And for those with mental handicap as well as elderly with disabilities, the work pressure has been very huge. Internationally, the definition for elderly is different from ours, so we have to face this squarely. And in terms of planning, the Labour Party is of the view that we should adopt a data-oriented policy. How should we go about it? You should look at needs or supply and demand. In the report, it said that by demand, you have to count the number of quotas at the moment and the new quotas as well as new services provided by the government. Then you can calculate the shortage level. In the past, for planning for policies, the government used the formula of service orientation. The government must be committed to plan for elderly services. Don't just give us a few hundred more places. 30,000 people waiting, and every year 5,000 odd are passing away. And you should plan for the number of carers as well. In the caring profession, we have 8,000 posts with 1,000 vacancies. The government uses this as an excuse to import labor. We oppose this. You should try to attract local carers to continue with the services. You should provide promotional prospect. So the government should shelve labor importation scheme and provide more places for local carers. Next, Ms. Lee Fong King. Mr. Chairman, I'd like to say something about those with cognition problems. My parents also had cognition programs. About 6 years ago, I was diagnosed to have the same illness. So you can see how exhausted I have been mentally and physically. Still, I want to serve my parents at home and to reduce the medical pressure on Hong Kong. I love Hong Kong as well as my parents. The work of caring for patients is a long-term and exhausting job. The carer needs to have physical and mental balance so that he is physically and mentally fit for future work.
I'd like to make several suggestions. First, the government should increase the daycare service and also short-term residential care, short-term daycare and short-term residential care, so as to support the families who have to care for the elderly, in particular those who are carers and who are also working, who also have their own jobs. The present carers allowance is subject to a high means test threshold. Should the administration consider a no means test system so as to encourage the carers and so as to help the carers and recognize their contribution? The government should enhance the tax allowance for the carers if they are living with the elderly, and also so as to increase the incentive. And I think this is also a common phenomenon. Many family doctors do not have a good understanding of dementia, elderly dementia. I found it. These family doctors just say that that's the way it goes for the elderly. Now, when they are confirmed, when the elderly are confirmed to have dementia, they are already at the middle or even advanced stage. If they can be identified at an early stage, they can be provided with training, and this will reduce the health bill on the part of government in long term. Thank you. Next, Mr. Lee Chi-yong, convener of 爭取資助院舍聯席. According to Report 62, there are 576,000 PWDs, 70 elderly, and 70% of PWDs are more than 60. When an elderly becomes a frail elderly, the frail elderly is a PWD. When a PWD has deteriorated to a certain stage, he is also an elderly. In discussing the elderly services program, the government should consider the aging issue in respect of elderly services. The provision or the support shouldn't just be limited to age, should not just be provided according to age. As for the community respite service and residential respite service, there are 8,300 waiting for the institutions, but there are only a few hundred. There is no 24-hour support. The carer looks after the elderly round the clock. There is no emergency support. When there's need for help, they have no way to turn to. There is no case management service. And now the case management is not an independent team. There's no power to deploy resources. The case managers don't have the relevant experience. As for carers policy, now the Western countries are the reference for Hong Kong. They have already had laws to recognize the carers and provided the recognition and also financial and statutory support. The protection for carers in Hong Kong is lagging behind other big cities. Now, there is a carer allowance scheme, low-income families given a subsidy in order to help the carers. According to LegCo paper, in 2010, the Welfare Services Panel had already passed a motion asking the administration to provide such an allowance. Yet the progress is very slow. We asked the government to conduct a survey to increase the respite service to 900, and that is 50 places per district. And there should be power should be given to managers to deploy resources, give allowance to carers who care for the elderly and with the PWDs. And there should be legislative support, and there should be laws to recognize the status of carers. A study should be conducted on the living conditions of the carers and the elderly or the disabled in order to formulate long-term policy. Next, Ms. Chang Lam of the Hong Kong Social Security Society. I participated in the public engagement exercises of Elderly Services Plan program. There weren't many elderly people participating in the engagement exercise. Many elderly just don't know how the Elderly Services Program plan will affect them. The elderly are not provided with adequate services. there is lack of planning. That doesn't happen in one day. It is a long-standing problem. We need to listen to the elderly. When they consult, they should consult the elderly, the carers, and also those who are young, because they do have parents and they have to care for their parents in the future. The consultation was only done at a certain place in Hong Kong, on Hong Kong Island. Shouldn't they go to the districts? They can have an open platform in, all over Hong Kong so that the elderly can know what is the relationship between Elderly Services Program Plan and the elderly so that they can give their advice. The plan will then be fitting for the needs of the elderly. Dr. Choi said that reports will be given to the government on every stage. When will the government publish those reports? As for community care voucher, the government is also conducting a review. When will such reports be given to the public? Publishing such reports enable the public to understand the current situation so that the public can give their views. I hope the government can tell us when will they publish those reports or disclose those reports. A demand and supply situation should be made available. Now the government asked the universities to conduct surveys. Those who need home cleaning, there are about 80,000 such elderly people who need home cleaning, and also another 80,000 need escorts to bring them to visit doctors, so on and so forth. In fact, there is a shortage of supply. Population is aging, people are aging. When will there be real planning? When will there be real increase in resources? If you just sit there and only start to do something when there is a tragedy, that will be too late. I hope you will conduct a comprehensive survey to gauge the situation. Next, Ms. Hoi Ching-yi. Many spoke on the aging of the PWDs. In discussing the Elderly Services Program Plan, the government should consider the needs of the aging PWDs. I want to make 3 points. First, elderly who live with their family members or PWDs who live with their family members should be allowed to apply for CSSA on their own. I'm a retiree. My son is 26 years old, and he is mentally handicapped. It's really hard for us to make a living. And the government should reinstate the policy before 1998 that is PWDs or elderly who live with their family members can apply for CSSA on their own. There should be assistance, financial assistance given to carers. And this will also, the proposal will also deal with the problem in which the elderly cannot live with their family members simply because they want to have CSSA. As for the $2 travel congestion concession, that was not very helpful for the PWDs. I think there should be improvement to barrier-free arrangements. The rehab bus service should be improved. The government should employ more rehab bus drivers so that some of the rehab buses will not be idling. There should also be a law to require the public buses, buses and also light buses to provide wheelchair space. There should be rehab bus to bring people to visit doctors. The government should also subsidize the PWDs to take taxis. My mother is wheelchair bound, and when I bring her to a restaurant, I have to bring her to make use of the goods lifts. It seems that those who are wheelchair bound have become second-grade citizens. The government should require buildings, be they public or private buildings, should be provided with barrier-free access so that everybody can go in and go out without any barrier. There should be arrangements to assist the 100,000 or so families who are caring for PWDs. There should be enhancement of community service for the elderly, give special measures to help the PWDs in order to achieve equality. Next, Ms. Chiang Lai Mui. I speak on behalf of those who fight for subsidized homes. The mentally handicapped are aging quickly. They have a strong demand for care. As for the PWDs who are above age 60, they account for about 70% total number of PWDs. The government's policy is not able to deal with the aging problem among PWDs. The carers will also become old and the problem will be more serious. From June to July 2014, there were 3 tragedies involving carers and the PWDs. You can still recall that. According to the current situation of the PWDs and the carers, the government's policy is not able to deal with the aging of PWDs. There is not enough public education. There is not enough residential places. There is not enough places at school. The waiting time for PWDs for residential homes is getting longer and longer. For the seriously mentally handicapped and seriously physically handicapped, the waiting time is 16 or 17 years for a residential place. There must be a comprehensive policy to deal with aging of PWDs that will make society more stable. There will not be more bigger backlog. There will be no more tragedies. PWDs, mentally handicapped, should also be included in statistics, and the information should be used for long-term policy planning. They should be basis for formulating policies. The plan for building residential institutions for the PWDs should be part of the planning or land supply process. The mentally and physically handicapped persons who apply for residential places should be given a performance pledge like those who are waiting for public housing. The government should formulate a long-term and comprehensive rehabilitation and service program so that people can see the policy targets in the coming 10 years so as to formulate so as to form a basis for manpower training and other related services. Next, Ms. Chiang Lai Man. I am a parent of a person who has Down syndromes. Those who are suffering from Down syndromes, they have physical problems, but they are optimistic and they bring a lot of joy to their families. The Downs family parents don't want to send their children to residential homes. They want to keep their children in the family so that they can live happily together. The issue I want to raise today is the aging of the PWDs and the carers. The government should consider aging of PWDs, the needs of a family who has 3 elderly, who has 3 generations of elderly people. Now, when the PWDs are sent to residential homes, the Down children, when they are sent to family, the institutions, they have emotional problems. Those who are suffering from Down syndrome feel that they are being dumped by their parents. But the parents have no choice. They are too old to care for their children. They send their children to the residential homes. They may one day need the care of other people. I just want to ask the officials and the councillors, if an elderly is old and weak, how can he or she care for their children who have Down syndrome? I'm afraid that one day I have to live in a RCHE, whereas my child who has been waiting for a residential home who is suffering from Down syndrome who has to stay in a residential institution, and that my child cannot visit me, and I don't have the ability to visit my child in the residential home.
So we feel helpless. Who can understand us? To take care of a child with mental handicaps, there are a lot of difficulties which I really cannot exhaust here. So parents don't want to send such children to RCHs. So you must have hostels for households with 3 elderlies or 3 patients of this sort, so as to reduce the living pressure on them, such that these families can enjoy community life. This will also ease the pressure on those waiting for RCHs. The mentally handicapped are also human beings. They should have a choice for their homes. So I hope that in your consultation exercise you can have broader publicity and promotion and to engage more people to enlist their views. Next, Ms. Elaine Lam from the Hong Kong Council of Social Service Task Group on Manpower Shortage. I represent the Task Group on Manpower Shortage of the HKCSS. We would like to tell you our 2 major concerns and 6 proposals. First of all, serious shortage of carers. We know that we have a 10% vacancy rate and 20% of wastage rate. The peak is coming with increased demands. This manpower problem is deteriorating. We propose the following 2 measures. For the basic posts, there should be promotional prospects to absorb young people into the profession. So to create such jobs, you have to introduce standard promotional systems and to have more attractive pay and benefits. There should be a framework to provide for mobility and promotion. Secondly, an image building exercise should be conducted to make such posts professional and to enhance social support and recognition for them. And for life planning in senior secondary school programs, students should understand the elements involved in joining such services so that they will join grassroots posts in future. And there's also a serious shortage of physiotherapists and occupational therapists. Most of these therapists are absorbed by the hospital authority. In 2013, there was a survey with a shortage rate of 33.9% and 22.3% for physiotherapists and 34% for occupational therapists. We have 4 major proposals. To attract therapists into the welfare sector, you have to increase their benefits and pay to improve their workflow. And together with the hospital authority, you should create senior posts to provide for promotion prospects to attract new entrants. And then for the new recruits, there should be in-service training and guidance. Number 3, to recognize overseas training programs and to encourage local universities to have distance learning programs and interface programs. And then new posts like a rehabilitation assistant should also be created to assist the therapist to ease their clinical pressure. Apart from elderly services, this elderly services program plan should take care of the aging problem of the carers to map out a planning and long-term policy that is sustainable, such that in the profession, our elderly and disabled services can receive quality services. Next, Ms. Wong Ming-Fong from 智障人士老齡化關注組. Mr. Chairman, our concerned group covers the recipients, family members, social workers, and enthusiastic citizens. for the specific conditions in Hong Kong, when we compare with the standards mapped out by the United Nations Convention, we would like to suggest some long-term plans. In the USA, the average age of recipients is 66 years old, and 50 years old is defined as elderly. So, in other jurisdictions, elderly comes earlier. Amongst the 700,000 elderly in Hong Kong, problems are to emerge in the coming few years. As for those with mental handicaps and weakened physical conditions and reduced care from family members, these elderly won't be able to integrate into the community and take care of themselves. We should comprehensively review our elderly services and formulate a long-term plan. This is very imminent. This is what a responsible government should do. In the year 2000, the economy was not good. The government launched a whole series of measures to reduce expenses. Therefore, shelter workshops, as well as related services and hostel or residential care services have been reduced. Therefore, the patients have not been able to receive suitable services, and newcomers have been rejected. There's also a lack of transparency. Services serving the mental handicaps are closely related to one another. So, to resolve this problem of aging of the mental handicaps, you should focus on the recipients. The RCHs at the low stream end are still inadequate. I don't think we want to see such a phenomenon. Our concerned group would like the Elderly Commission to take care of the difficulties of the mental handicaps and in future plans provide specific arrangements for the mental handicaps. Next, Ms. Low Lai Ping from Kwai Chung Chun 長者權益關注組. Ms. Low, good morning, everybody. To take care of the elderly, you have to take care of the special needs of the elderly. We have the young elderly, middle-aged elderly, and old elderly. All these three categories of elderly persons need services. I think prevention is better than cure. You should examine how to take care of the three generations of young elderly, middle-aged elderly, and old elderly. Canteens should be set up such that the elderly persons will have sufficient nutrition and lead a quality twilight life, and they won't panic. And there should also be sustainable care for these elderly persons so that they can lead a healthy life. And then the younger generation will feel comfortable to go out to work. They don't need to worry about their elderly family members. As for prevention and integration into society, as well as social activities and recreational activities, to allow the elderly persons to absorb and increase their knowledge, you must do something. Otherwise, they will panic and feel helpless. For example, in Kwai Chung Estate, we have a facility known as the Stone House, managed by some volunteers to serve the elderly. These volunteers want the elderly to live happily. The elderly served find meaning in life then. And in the Ashbury Community Center, activities are organized to enrich the life of the elderly so that they can live better. Thank you, Ms. Low. Next, Mr. Wong Yun-tat, a member of Kwai Tsing District Council. Thank you, Chairman. We had 60 home care teams before December. We have seen no growth in number. And the subvention has not been able to catch up with inflation. Now 20,000 elderly are receiving a subsidy, but 5,000 elderly are still waiting. With an aging population, and 1/6 of our population is an elderly, but then in 25 years' time that will increase to 1/4. In Kwai Tsing, we encounter the same problem. The aging problem is serious than the territory average. We have this indicator of a waiting time of 3 years for PRH, but for elderly who need residential care service, there's no such indicators. On the average, they have to wait for 7 months. For the special cases, for an ordinary case, the waiting time is not specified. It will even be longer. There's this example of a gentleman, 80-odd years old. His wife is living in an RCH. He's queuing up, and from the beginning of last year till now, he's still waiting. Upcoming is the cleansing program for his home before Lunar New Year. Who is going to help him? What if he falls? He only have a few $100s of CSSA. He can hire a home carer or a domestic helper. So the LWB should set service indicators. For example, to wait for a year for home care and 3 months for delivery of meals. Now we don't have these service indicators. It would be very helpful to have such indicators. Number 2, in the vicinity of Kwai Chung Estate, there will be 2 new development projects. The SWD proposes a day care elderly service center on the ground floor, which is not near to phase 1 of Kwai Chung Estate. So we propose a swap between that center and the HA office. It's difficult for an elderly person to walk for 10-odd minutes. So we would like the location of such centers to be more accessible. We also propose enhanced manpower to ease the workload of the existing carers. Community canteens should also be set up for the less mobile elderly, so that they won't need to patronize ordinary canteens, which are more expensive than community canteens. So service indicators and waiting time indicators should be formulated. Next, Mr. Chow Kam Pui from Neighborhood and Worker Service Center. Thank you, Mr. Chairman. The first point I'd like to mention is that the government, particularly the LWB, should face squarely the result of this study report and to address problems specifically. In the past, we attended just too many consultation sessions of this sort. But eventually, the government might not respond positively to the recommendations in the reports. For example, Professor Nelson Chow, in his report, put forth a number of recommendations. Professor Chow even told the government which options were more feasible, but the government evaded the report conclusions and recommendations. Mr. C.Y. Leung said that there would be another consultation exercise. He did not properly and appropriately address Professor Nelson Chow's report. So to a certain extent, I'm worried about Dr. Choi. At the end of the consultation exercise, the government may be wasting the consultation report. It may waste 2 more years on the handling of elderly problems.
The administration has to be honest and face squarely up to the report, and not just this report, but also other similar reports. In the past, I attended 5 focused group meetings, and there were members of the Commission on Poverty attending those focus group meetings, and there was the issue of considering the pushing back of age of retirement. We have no objection of extending the age of retirement, but we are against deferring some public welfare in order to deal with the aging population. We strongly oppose to deferring the giving of welfare services. Now, if elderly people want to work, if there is a demand for their service, they can choose to work. The government can encourage employers to employ elderly employees. But if the government defers the giving of Social Security so that the elderly have to work in order to maintain their living, then in fact the government has taken away the choice of the elderly, because if they don't work, they really can't survive. Thank you, Mr. Chow. Next, Mr. Secretary Wong of Yuen District Council. The administration is willing to do some planning for elderly services. That's a good thing. But with regard to issues in the district, many families have 1 or 2 elderly who are 70 or 80 years old, and they are caring for a son or daughter who is mentally handicapped. Their problem is even greater than a family which only has elderly people. The government has ignored this problem. Because of government policy and because of segmentation of services, there are many absurd scenarios. Say, for example, an elderly is waiting for a place in a RCHG, and his son, who is mentally handicapped, is also waiting for a place for an institution. Now, when it's time for the elderly to move into a RCHG, his son is not yet given a place in the institution, caring institution. So he cannot go into the RCHG because he has to care for his son. Now, there is a carer's allowance for those who care for the elderly, but there is no carer allowance for those who care for the PWDs. In another case, when there is an elderly living in a public housing estate, then there is repair and maintenance free of charge if there is a problem with the unit. But if this is a family who has a mentally handicapped adult, then the home will not be given free repair. Now, there is free injection against flu for the elderly, but those elderly who, if a mentally handicapped or a PWD lives at home and he is not, he is below 60, then he is not given a free flu injection. But if he lives in a residential institution, then he is given a flu injection free of charge. Why is that so inconsistent? Now, many, including earners, have spoken on families who have a PWD. I don't know whether we have no channel to speak on PWDs, on the needs of PWDs, and therefore we come to this meeting, which is about the Elderly Services Program plan. If you look at the rehabilitation white paper, we had it 20 years ago, and since then there is none. We have no no committee to formulate policy on the aging population, the aging problem of the PWDs. The government should set up a rehab council. Next, Mr. Kwong of the 全港長者及護老者權益聯席. Good morning. I represent the 全港長者及護老者權益聯席. I want to make 2 points. First, integrated home care service. There were 60 teams 10 years ago, and after 10 years, today, there are also 60 teams, 60 integrated home care teams. That's really absurd. Population is aging. There is a demand for home care service. The government should increase resources according to the increased number of elderly. There are young elderly, medium elderly, and old elderly people. Different age groups have different numbers, different needs, because of different physical conditions. According to different age groups and physical conditions, the administration should provide services accordingly. For the mildly old, for the mildly handicapped, medium handicapped, and seriously handicapped, they have different needs. In 2014, there was a policy forum on elderly services. More than 110 elderly attending the meeting, and there was a discussion on the scoping of elderly services planning. In terms of scoping, there shouldn't be a segmentation or segregation. Either is aging, active aging, or there's long-term care. We should not polarize the issue. Integrated home care service helps to defer the deterioration of health among the elderly. If the elderly is not given adequate support, their health will deteriorate quickly. They will have to be cared in residential homes, and more resources will be needed. Prevention is better than cure. Elderly services help to prevent rapid deterioration of health among elderly. The provision of service should be provided according to the physical conditions and age of the elderly. Thank you. Next, Ms. Yuen of the 將軍澳長者民生關注組, or 將軍澳Concern Group for People's Living. Good morning. I want to make 2 points. There should be emergency support service. The elderly who are living alone, or the elderly people who some families are just made up of elderly members. They don't have any young members. If they have any problem, they cannot get any help or immediate service. And this only increase the risk of the elderly. We propose that the SWD should provide emergency support service. Elderly who are living in a community can be provided with immediate help. Say, for example, meal delivery, provision of escorts to bring elderly to see doctors. These are much needed service. They are just short-term services. There should be service targets and also an objective market monitoring mechanism. With regard to home care service, the waiting time is very long. Now, if you want a meal delivery, you will have to wait for meal delivery service. You need to wait for at least half a year, sometimes even a year. As for home cleaning service, the waiting time is even much longer. We propose home care service should be subject to a performance pledge like public housing, so that the elderly knows the waiting time and also their positions in the queue. Now, in using service, some elderly people are asked to withdraw or even reduce the use of service so that other elderly can have access to the service. Say, for example, the meal delivery is an example. To prevent the service providers juggling with the service places by cutting or reducing service to existing service users, there should be an objective monitoring mechanism so that the elderly will be given adequate and appropriate service. Thank you. Madam Mac. Next, Chosen Parents Network, Madam Mao Yin-fong. Thank you. I want to raise 4 points. There should be no hindrance to information. Well, I joined a Center for the Elderly, but I'm a member of Center for the Elderly, but I am not informed that there is this consultation. There is a consultation on Elderly Services Program Plan. There should be free flow of information. Now, apart from paper in large fonts, there should also be additions for in other languages for the ethnic minorities. There's user groups, representatives from the disabled and also from the ethnic minorities in the consultation process. We need to consult the elderly as well because the young have to care for us. Now, I have a friend who is 80 years old. His husband died, and then she now is living with a 50-year-old girl, 50-year-old daughter who is suffering from who is mentally handicapped. And now the child is now living in a residential home, and the elderly, is now living alone. Now, originally, they were living together, but because the child had a place in a residential home, then the family is now broken up. Why can't the institutions accommodate the mentally handicapped together with their parents? We can choose to live in an institution or live in a family. As for elderly who receive service, can they just go to the community support center? Can they use mainstream service centers for the elderly? As for protecting the rights, we should be allowed to participate in the drafting process of various reports to make our voice heard. The government should comply with the relevant conventions to give us equal rights and give support to us so that we can participate in the policy-making process. Women and ethnic minorities have not been given due consideration. Now, please give your view in submission if you have not, you are not able to finish. People should be allowed to live in dignity. Thank you. Next is Carers Alliance for the Dementia. Madam Chang. Good morning, Chairman. With aging of population, 1 in 7 elderly are suffering from dementia. Our population is aging. Now, the data can only reflect those who are above age 70, but the onset of dementia is not just limited to the elderly. In fact, there are more than 100,000 people suffering from dementia. By 2030, the number will be more than 150,000. We can see more and more young people who are suffering from dementia. We are concerned that whether there is adequate care for the dementia and also for their family members who are carers too.
For those patients and their family members who do not match the age requirement, you should also provide services. There are 3 proposals here. First of all, long-term medical plans. For these dementia patients, they gradually lose their abilities in speech, reading, and physical abilities. So speech therapy, etc., can be helpful. There should be community nurses to do follow-up for discharged patients. There should also be educational talks and seminars, as well as workshops to help with home care. That will also help with the policy of aging in place. Secondly, professionalization of the carers. Many carers don't need how to take care of dementia patients. Lack of knowledge is a serious problem. Therefore, there are crises with the service recipients. Many of these service recipients don't even know how to express themselves. They can't even tell how they're treated by the carers. So there must be professional training in knowledge, such that every carer will understand more the dementia patients, elderly dementia patients. Number 3, in accordance with the actual needs of the patients, assessment and streaming should be done. At the moment, dementia patients don't have a second choice. Sometimes they may have to rearrange their living plans. So there must be assessment and streaming for these dementia patients, such that young dementia patients will get appropriate service. Thank you. Next, Victoria City Social Service Center, Mr. Mark Lee. Thank you, Chairman. I'd like to say something about the aging of the mentally handicapped and their carers. At the moment, we say that if you have a disability, the disability will stay with you forever, so you are stigmatized. If you are old, then you are old. You won't have other special features. Well, such concepts are not realistic. We can provide the patients with suitable care. The mentally handicapped age quicker than others. International studies indicate that they start to age at the age of 35. According to my studies, in certain cases, aging even started with the 22 and 23-year-olds. They can't hear, they can't see, they can't remember things, so sometimes they lose their way when they go home. If we set a certain age in providing services, we will not be addressing the reality. We should have archives and databases such that we understand the living processes of these patients. We should look at the actual functions of these persons and not their actual age. We should conduct assessment. Sometimes these patients are still young, they are not aged yet, and they may be interpreted as having behavioral, emotional problems with poor working performance. They're forced to take a lot of medicine, and they're put under a lot of constraints. They may be demoted in their workplace. But in actual fact, it's very simple. They're aging. However, they are put under unnecessary restrictions and control. That's really pitiful. In actual fact, their parents are older than they. A 90-year-old elderly stays in an elderly home, and then he has to travel for 2 hours every day to prepare a soup for his elderly son. Can we have some homes that can take care of these elderly patients as well as those younger patients or children who are not yet aged but who are ill? And we must have sufficient support services for them. We should also review the guardianship board. We should develop support policies and develop strategies for the third party, so to speak, so as to give sufficient and appropriate care to the patients. Next, Liberal Party Youth Committee, Mr. Harris Young. Thank you. Good morning, everybody. All along, there are a lot of concerned groups that ask the government to conduct a comprehensive review of its elderly policies so as to increase the number of subvented RCHE places as soon as possible. But all along, the government has not set any objectives and formulate any performance pledge. Physical conditions, living conditions, etc. should be considered in the formulation of future plans. So I hope that the government will have short, medium, and long-term plans. We are now facing a basic problem, shortage of subvented RCHE places. So the solution is to build more RCHs. But very often the RCHs are not welcome. The government encounters a lot of difficulties in site location and construction. Therefore, the government should consider reserving land in public works projects for RCHEs. For example, certain ground floor units of PRH estates should be earmarked for RCHEs. And a shortage of frontliners is also a serious problem facing us at the moment. One of the reasons is that this industry is viewed as an obnoxious industry. The carers have to handle, say, the excretion of the elderly. And there are no new entrants, so we have a gap here. And the incumbent carers may change job, adding to the problem. In a 2013 survey by the HKCSS, the wastage rate of the frontliners was 20%, a wastage of 1,000 persons. And the average age of the carers is now 55 to 59 years old. That means in the next 10 years, a lot of carers will be retiring, and the shortage will become even more acute. Manpower shortage will definitely affect the future service standard of the profession. This will definitely happen. The government must face it. And you must address the short-term manpower shortage problem. So to improve services, the government must consider how to attract new entrants. And where necessary, there should be a relaxation of the labor importation scheme. And then there should be more training programs to nurture more professionals and to absorb new professionals. In future, we'll see more elderly services for sure. Next, the DAB representative, Ms. Chang Fan Lan. Thank you, Chairman. Concerning elderly services, we must mention residential services. The government must formulate plans, 5-year plans for residential care services for the elderly. I think an acceptable timetable should be formulated. For example, for waiting time, we think 6 to 12 months is more appropriate. At the moment, many elderly persons are waiting endlessly for a place. Their family members and themselves are very worried. Besides, it's better to have a uniform assessment mechanism. Many speakers just now said that there are gaps among different programs As for the voucher scheme, the vouchers should be used both in community care services, daycare services, and residential services. And the number of subvented home carer posts should be increased. There should also be enhanced training for the service personnel. In some homes, there are professional carers, so professional training is also very important. A speaker just now said that there's an acute shortage of manpower and an acute wastage problem. Under the lump sum grant system, the salaries and conditions of service of the workers are seriously affected. We have the people, we have the physiotherapists, occupational therapists, etc., but they don't work in this sector because the salaries and conditions of service do not warrant a stable service from these workers. So you should review this as well. Apart from RCHEs, we would like to enhance home care as well. For example, the service hours should suit the timetable of the elderly person served. We should not just suit ourselves, our own working hours. And then elderly at risk are also discovered. For medical facilities and services, they should suit the elderly persons. For example, the outpatient clinics or services, the hotlines are always not manned, so the elderly persons feel more helpless. Well, so much for session 1. However, session 1 should finish by 11:35 a.m. Since we have no more speakers, theoretically, I should ask the officials to respond. But just now, Dr. Fernando Chang said that he had to rush back to the university to teach. So I'll give him 2 minutes first before inviting the officials to respond. Mr. Chairman, I'd like to thank the deputations and individuals attending. In fact, we've been co-workers for many, many years. We've been struggling for years. I am really saddened by their remarks. The situation is appalling. There's insufficient community care. The waiting queue is very long for services. Some have to wait for over a decade. Some elderly persons, 5,000 odd of them passed away before getting service. And then the vacancy rate of bought places is very high. And the wastage rate of staff members has been as high as 20 to 30%, even for the professionals. So, Mr. Chairman, what are we talking about? We're talking about caring for the elderly and the weak, as well as the disabled. So many organizations have said that we're talking about long-term services. There shouldn't be any differentiation by age. Even for dementia patients, they don't just emerge after 65 years old. Well, there are 3 areas here. 2 are about voucher schemes. That's what the government told us. Now they're thinking of a voucher scheme for RCHEs. And we have the elderly service vouchers. Well, if you want to further commercialize the vouchers, that's not appropriate. Well, commercialization already emerged for the elderly service vouchers. So please don't commercialize these services anymore. And don't classify the patients by age. You should do it by way of the services they need. Well, I think the deputations and individuals have put forth a great deal of opinion, some very broad in nature. Perhaps I should sum up a little bit such that the government officials and Dr. Choi can respond. Well, the aging of PWDs, can they be covered under the Elderly Services Program Plan? For example, you should upgrade your assessment standards. And what about the second round of public consultation? Can you do a consultation among the 18 districts on elderly-friendly environment? Perhaps I should first give Dr. Choi 2 minutes and then 3 minutes to the government officials. Thank you, Mr. Chairman. Thank you for the opinion.
The study team has the academic responsibility to study many issues. But our team is bound by the contract, so we can only do our best to find a suitable balance. And we try to make our school as inclusive as possible and meet the needs of the community. But we are still bound by the terms of the contract, and we still have to submit our report to the task force or working group under the Commission on Poverty. And the report is given to the working group, and it is up to the working group to decide whether it accepts the report or not, and whether it will disclose the report to the public or not. All the issues should be considered by us. As for public engagement, in the second and third phase, we are still planning the public engagement process, and we'll try to explore the channel, as many channels as possible. Please consider going to 18 districts. The Permanent Secretary said by Dr. Choi, we have listened to your views, and we're glad to hear that. And during the public engagement exercise, in the first phase, we also heard views from the groups, and some views we heard today have not been heard before. As said by Dr. Choi, the views be collected and they will be given to the working group under the Commission on Poverty, and then the working group will formulate the next process. We will consult you again. As said by Dr. Choi, how should we disclose the information, and how should we conduct the next phase of public engagement? We have an open mind. We have listened to you very carefully. We'll go back to the working group and also the Commission. I believe the Commission and the working group, having heard the views, will decide on the way forward whether the consultation will be conducted in 18 districts, as said by the chairman. Some also asked to work through the organizations providing a service to the elderly, and some even suggest to do consultation via the elderly groups. Now these views will be considered. After we have finished this stage, when we go into the next stage, we will also consult. And we will only formulate the plan after the public engagement exercise. Now, I've heard the views today very carefully, and I also heard the analysis by the chairman, and we will bring all this back to the Commission. As for the scope of service, the degree of deterioration, the age group, delineation, carer support, and also needs of the elderly, are all issues which we will continue to consider. And then we'll add all these into the views collected by the consultants team. All right, we have reached the end of this session, and I thank the groups for coming to give their views. We have a break of 3 minutes. And then and then we will ask the second group, second batch of speakers. I think we may need to extend our meeting by about 15 minutes for to enable members to conduct some discussions.